Good afternoon po. Ito po yung PowerPoint namin tungkol po sa system namin na Healthcare Information System for Senior Citizen in Mamatid Health Center. Chapter 1, Introduction, Background of the Study. Mamatid, officially known as Barangay Mamatid, it is located in Cabuyao City, Barangay Mamatid, is one of the 8 urbanized barangays comprising the city of Cabuyao in the province of Laguna, Philippines. In our research, it has a population of 50,213, making it the most populous barangay in Cabuyao. We found out that Mamati Health Center are collecting data by manually doing paperworks. The system that we are developing will help the barangay staff to monitor and collect medical information easily. Statement of the problem. Manual methods are prone to damage and being misplaced of their medical record or healthcare data. Senior citizens are at high risk if they are exposed to long to fall in line at the clinic. Manual methods are very time-consuming. Objective of the study: to avoid the document or healthcare data being misplaced, to increase and improve the quality of service so that it will lessen the risk of the senior citizen, to lessen the long queues of the senior citizen by falling in line. The scope of the study in Chapter 1, the System Healthcare Information System for Senior Citizen, focus on monitoring and storing patients' electronic medical data. Healthcare Information System for Senior Citizen. Information management can be used in different ways. For this project, the researchers created an information management system that will focus on the health records of senior citizens. Limitation of the study. The study would not include other patients' medical record. It's only exclusive for senior citizens. Healthcare information system is limited only for Mamatid, City of Cabuyao. Admin must have been trained and well-oriented to the system to use correctly. The significance study of Chapter 1. Center. It will help the center to easily manage and lessen the efforts of monitoring and storing every patient's electronic medical data. It will also help the center to easily acquire every patient's information and will access to see their medical patient. It will help the patient to have an access to see their medical records. It will also help to lessen the long queues of the senior citizen by falling in line. Researchers. This study will help the researchers for creating the study regarding on how to record the files or information and etc. It will also serve as a technique for patients to develop a capable designing system for future opportunities. Future researchers. The study will serve as a guide for future studies and it will also help the future researchers that will develop the same system to improve problems in the healthcare information system. The study will also serve as a reference or a related study of the future researchers. Chapter 2, Review of Related Literature and Studies. This chapter presents the foreign literature, foreign study, related study, local literature, and local study. This also includes the conceptual framework and the definition of terms. In foreign study, healthcare information system. In 2012, health systems in low and middle-income countries continue to face considerable challenges in providing high-quality, affordable, and universally accessible care. In response, policymakers, donors, and program implementers are searching for innovative approaches to eliminate the geographic and financial barriers to health. This has resulted in mounting interest in the potential of e-health, the use of ICT for health, and mHealth, the use of mobile technology for health. A subset of e-health in low and middle income countries. Foreign literature. Based on the study of the author 2018, clinical information systems provides remedies opportunities to reduce clinical errors such as medication errors and diagnostic errors and to support healthcare professionals by offering up-to-date patient information. They promise to improve workflow and efficiency of care, thus boosting the overall quality of healthcare. CISS have generated opportunities for meaningful improvements both in patient care and workflow, but there is still a long way to perfection. Healthcare providers are still facing challenges of data exchange, management, and integration due to lack of functionality among these systems. Our objective here is to systematically review, synthesize, and summarize the literature that describes the current stage of clinical information systems so as to assess the current state of knowledge and identify benefits and challenges. Related study of healthcare information system. In 2011, the use of integrated hospital information system is related with many benefits for the healthcare system, increasing the effectiveness of the provided services and assuring quality of care. Aim of this study is to investigate the types of information systems, the level of integration, and the problems identified during the implementation phase in 3 public hospitals. The above are expected to contribute to the understanding of the organizational, human resources, and technical factors related with the successful implementation of a hospital is in order to investigate those elements and a assessment questionnaire was developed and completed by 9 hospitals, IT employees, and of the 3 hospitals. Related literature. Based on the study of the author in 2017, the user in this paper is not a medical specialist, but a real user of healthcare, a patient. The paper starts by looking at the lack of impact of information systems in healthcare, examining the causes as published in the literature. An overview of these causes is enriched by the concerns arising from the first author's personal experiences as a Parkinson's disease patient. About 4 million suffer worldwide for over 12 years. 7 short ethnographic studies are told as the basis for supporting this user perspectives of these concerns. Local study. In 2018, the healthcare system in the Philippines has undergone dramatic changes in the last 20 years as the government has instituted various reforms and policies to provide easy access to health benefits for every Filipino. The Department of Health lists 1,071 licensed private hospitals and 721 public hospitals. The department takes care of 70 of the public hospitals, while local government units and other state-run agencies manage the rest. Local literature. Based on the study of the author in 2017, is using a manual system in terms of implementing medical services, health programs, health monitoring, and profiling. This transaction as implemented by a midwife in charge in a barangay health station are done manually. The different processes involved in health programs are immunization, tuberculosis, and family planning. Medical services involve medical care, consultation, child care, postpartum, and parental health monitoring involves users. Early childhood care and development, morbidity, and animal bite and profiling involves formally. Chapter 2 Synthesis. In summary, the development of an healthcare information system would not just help and improve the management of the center to monitor each of the patient's record but also have an access to see their medical records and will focus on the health records of senior citizens. Chapter 2 Conceptual Framework Input Process Output In input, knowledge input, interview, questionnaire, book, and internet. Software input, Sublime Text, MySQL development tools, PHP, CSS, framework, C Sharp, process, waterfall model, output, our system, healthcare information system for senior citizens. Chapter 2, operational definition of terms, administrator, a person who is responsible for running or managing a business organization. PHP is a widely used open source general purpose scripting language. Is especially suited for web development and can be embedded into HTML. SAM is a free and open source cross-platform web server solution stack package developed by Apache Friends, consisting mainly of the Apache HTTP server, MariaDB database, and interpreters for scripts written in the PHP and Perl programming languages. MySQL is an open source relational database management system. Its name is a combination of the name of co-founder Michael Voidnews' daughter, and SQL, the abbreviative for Structured Query Language. Database, a structured set of data held in a computer, especially one that is accessible in various ways. Health center, a building or establishment housing local medical services or the practice of a group of doctors. Patient, a person receiving or registered to receive medical treatment. Sublime Text, a programming language that is used to develop a web-based application or system. Waterfall model is a breakdown of project activities into linear sequential phases, where each phase depends on the deliverables of the previous one and corresponds to specialization of tasks. The approach is typical for certain areas of engineering design. In software development, it tends to be among the less iterative and flexible approaches, as progress flows in largely one direction through the phases of conception, initiation, analysis, design, construction, testing, development, and maintenance. In Chapter 3, there are research methodology, where the first one is requirements, design and coding, testing, deployment, and maintenance. The process steps, requirements. This is the first phase in developing the system where the software and system requirement is determined. A programming language will be chosen. The functions and initial design of the system will also be discussed. Design and coding. The second phase involves the construction of the system as a whole. The specification, features, codes, and design will be finalized. Testing. The third phase is divided into two parts, the initial testing and final testing. Both parts involve checking all the functions of the system and make sure that it is properly working and the features are running as intended by the proponents. Deployment. The fourth phase is the time when the system is running well, in good condition, and ready to be endorsed to our client for installation and full operation. Maintenance. This is the final phase in the system development, where the good communication between the proponents and the respondents must be maintained. In this step, the system can be updated or upgraded depending on the suggestions and feedbacks of the respondents. This step is important to make sure that the respondents are satisfied with the constructed system. In Chapter 3, there are the research design, implementation, project design, flowchart, activity diagram, evaluation, procedure. In project design, there's a user who connect at website overview, registration, user accounts, status, patient list, and login. Admin, login, user approval, user accounts, add new account, patient list, insert, edit, and delete. In our flow chart, let's start admin, admin to user, user to user request to accept and reject, back to user, user to block or unblock, back to admin, admin to medical data, medical data to patient list, medical data to insert data, edit data, and delete data. Patient list is the status and diagnosis a patient. In activity diagram, user to user, patient forum to status, status to diagnosis, diagnosis to save to database, patient to forum to transact to database, user to admin, fill up the form, validate the data, notify admin for user request, evaluate, admin approval, and save to database. User, doctor, and patient, fill up the form, validate, database notify admin for request, evaluate, wait for admin approval, and save to database. This is our survey results. The functionality. How convenient is the manual system? The average of that question is 2.28 dissatisfied. Number 2, manual system meets your need. Average 1.92 dissatisfied. 3, manual system user-friendly, 2.5 undecided. 4, manual system reduced time consuming, average 1.9, very dissatisfied. 5, manual system interactive, 2.2 dissatisfied. Average of all functionality is 2.16 dissatisfied. B. Reliability. Number 6, reliable in collecting data, average 2.12 dissatisfied. Reliable in securing data, average 2 dissatisfied. Safe to use in collecting data, 2.22 dissatisfied. Reliable in personal information, 2.16 dissatisfied. Reliable in time consuming, 1.96 were dissatisfied. Average of reliability is 2.9 dissatisfied. Collecting data. How convenient is manual system in collecting data? Average 2.92 undecided. User-friendly, 2.36 dissatisfied. Reduces time when collecting data, 1.94 dissatisfied. Retrieving data, 2.18 dissatisfied. Security of collected data, 2.8 dissatisfied. Average of collecting data, 2.29 dissatisfied. D. Efficiency. Finding customers' information data, average 2.14 dissatisfied. Dissatisfied. How efficient when collecting data? 2.32 dissatisfied. Time consuming 1.96 dissatisfied. Speed 1.88 very dissatisfied. Accurate in collecting data 2.32 dissatisfied. Average of efficiency 2.12 dissatisfied. Security. How secure the data when collected? Average 2.4 dissatisfied. Patients data security 2.14 dissatisfied. Monitoring of patients data 2.2 dissatisfied. Dissatisfied. Security of personal information 2.2 dissatisfied. Data integrity 2.28 dissatisfied. Average of security 2.17 dissatisfied. Overall weighted mean 2.16. All dissatisfied. Thank you very much.